Brandee Schappell is a busy 47-year-old. She stays active with her 2 older children, and just days before her heart attack, went on one of her 3-mile runs. Her cardiac symptoms began a few nights later in the evening.
I didn't know what was happening. It wasn't a sensation that I'm used to feeling. It wasn't what I thought it would feel like. It was, I had like a pressure in my chest, like right in the middle here, that spread across my shoulders, but it wasn't painful at first.
Later that night, she went to the hospital. She ended up having 3 stents put in to manage a blocked artery. But her release from the hospital was just the beginning of her recovery. Almost immediately, she began outpatient cardiac rehab with exercise physiologist Allison Cannon.
Cardiac rehab following a cardiac event is extremely important. Oftentimes, the patients are scared. They have a lot of apprehension on what they should be doing at home, how to go about doing it, how do I know I'm not going to overdo it? So it's a perfect time for them to enroll in the program so that we can give them all of the tools that they need as far as exercise progression.
When you first go, you started really small. So we would get on the bike and we'd warm up for like 3 minutes and then increase the intensity to a certain level. And for everybody, it would be different. It would be what you're comfortable doing. So they would watch your heart rate and monitor that to make sure that your beats per minute aren't getting too high.
Over 12 weeks, Brandee discovered how to get her whole body healthy.
I realized that I wasn't in the shape that I thought I was. They also, when I exercise at home, I would mostly run. I didn't use muscle strength, so they incorporated different aspects of exercise, muscular, physical fitness, as well as cardio.
It's the perfect time to educate them on risk factors and risk factor modifications, specifically smoking, diabetes management, obesity, sedentary lifestyles, blood pressure, cholesterol, stress management. Really, we touch upon all of those things in great detail.
They were very encouraging and supportive, which made me want to come in. I went 3 days a week.
She's now graduated from cardiac rehab, confident in her healthy future.
Being hooked up to the heart monitors, like having my blood pressure checked 3 times a week, it gave me security that I was okay.
She had a desire to learn. She had a desire to learn how to exercise on her own safely, so that she could get back to her normal everyday life, which is really the bottom line and the goal of our program. Is we want our patients to get back to their everyday life and have the confidence to do so.